so as you can see, I'm not the only person in dental, and we are new to dental that started at another industry, and we are here to help you. So make sure that you reach out and you look for the help. Let me pass that one there. There we go. All right. So make sure when it comes to software that you're not just learning and focusing on your practice management software. And again, I started you earlier today or earlier in this course, make your own list of what you need to learn. Don't be reliant on anybody else. So you can learn some of this on your own, but I would suggest for sure your patient management software. If you're in the back or you're going to be helping in the back, digital scanning, digital x-rays, the intake form. If you're paperless, what software are you using and how are you doing it? Inter-office communication, what are you guys using for talking amongst each other? Make sure you understand how you use it. Office, online scheduling, phone systems, your marketing. If you've got software to do your marketing, you're going to be helping. Supply ordering. These are just some of the things that if you're going to be responsible or working in these areas, take the responsibility. Write them down now while it's fresh. You may not learn it today, but know that that's something you want to invest some time in so you can get proficient in it, okay? So now let's talk about office flow. Every office flows differently, but there needs to be a flow to your office. So I'm going to talk a little bit about how you can manage and learn the flow of your practice, because just like an auto assembly line, right? Or just like if you go in Chipotle or one of these restaurants where you order and then you go to the next person and they go to the next person and you know what's expected, that's what should be happening in the dental office. We should have a flow for our patients when they come in. So what is your assembly line flow? All right. What happens from the minute, I should even back this up. What happens from the minute the patient calls in and schedules the appointment to when they check in, to when we do the procedure, to when we present the treatment, to when they get scheduled for their next appointment, to when they check out? I can tell you what my flow is, but you need to know for your office. And you need to find out, and if not, help design a flow that's like, okay, from here they go to here. So they go from Susie to Mary, and then Mary sits them in the chair, and then the doctor comes in, and then the assistant gets them, and then they go back out to Susie, right? You want to know what the process is for your office. Now, this is just an example of what we have at Front Office Rocks for the new patient appointment flow. What order and what steps happens during the new patient appointment. Now again, this is our suggested flow, but this doesn't mean this is what happens in your practice. If you don't have a new patient appointment flow, you can take this and tweak it, and you can work with your team on it. You can fill these blocks in yourself, but just understanding that there should be a process to a patient flowing in your office. Once you understand the process, then the next step is how do we get the person from A to B? How do we get the patient from Susie to Mary? And that is done by handoffs, okay? What we don't want is we don't want our patients just aimlessly walking around the office. We don't want patients going, where's Susie? How do I find Aunt Mary's desk? We want to take the patient to the next person. We want to hand off the patient to the next provider that's going to be taking care of them. That is good control. So a handoff is how we do that. Now, many offices will talk about handoffs, that they do handoffs, but they don't necessarily do them fully, completely the way I'm going to show you. So if you can take what I'm teaching you and integrate it into your practice or into your habits, that would be great. You can also re-show this to your team to talk about the importance of handoffs or other videos that I have on that, because the better we get at handoffs, the better the flow is for the practice. So handoff should start with an attention of the person receiving the handoff. So when somebody's bringing a patient to me in the front desk, or I'm taking a patient back, whoever I'm handing the patient off to should be paying attention. Sometimes that's hard, so we have to make sure that we give them the availability a minute or two to get off the phone or whatever they're doing so they can take the handoff. We should review what happened when we were with the patient and what needs to happen next. Review any discussion that happened with that patient and review that to make sure that the discussion, if it's pertinent for the next step, that they know it. And then acknowledge from the receiver and the patient that the handoff, what I've told you, is correct and that you understand. So there's an actual process to handoffs. Now, we do handoffs anytime the location changes, or we should be. So if the patient's going from the reception area to the operatory, there's a handoff from the receptionist to the assistant or the doctor or the hygienist. Anytime information happens, so if something happens in a conversation that I need to make sure the next person knows, I want to hand that off. Anytime the provider changes, so when the assistant's in with the doctor and the doctor walks in, I want to do a verbal handoff to the patient. When the hygienist is with the patient and the doctor walks in, I want to do a verbal handoff to the doctor. And then anytime we change a step in appointment, so if I move the patient from the operatory to the consultation room and somebody goes to take over in the consultation room, I want to hand the patient off to that next person at that point. The next thing that is important system that you'll be involved in or should be involved in, your team should be doing, is Huddles. Okay, Huddle is our meeting in the morning to get us started. So in the morning we review, or we should be reviewing, how are we doing? What are our goals for the month? Are we hitting our numbers or not? What are our challenges for teamwork? What does the day look like? Where can we work together? What opportunities do we have to make the schedule productive, to make us work better together as a team? Like, where is it going to be a little crazy and where can we all jump in and make sure we get through the flow really well? And then I love to end the huddles with an inspiration or something motivating to the team, some way to get everybody leaving on the same page, excited to go. So a huddle is something you should do every morning. You probably, if you're in an office that does it, you probably do it 15, 20, 30 minutes before the first patient, and it should flow the same way every day. You should follow an outline. If you don't have one, we have them available at Front Office Rocks, or you can work with a company like Dental Intel where they have a morning huddle that you can follow the form and you can follow the process every time so that you guys go through the schedule fast, you go through the important data fast, you transfer the information that's needed, and then you guys set off for your day. So important things about the huddle that you need to know is, first of all, everyone should show up on time. Everybody should do their part. Everybody should be focused at the moment. We're only in here for 10, 15, 20 minutes, so focus on what's going on and what we need to talk about. Don't just focus on production. Let's talk about the patients, who has a balance, who needs to refer their family member still, who referred somebody to us, we can thank them. And then we should have this outline every day like I talked about, and it should run the same way every day. All right, last two things, and then I'm going to give you guys a break. So the next thing is HIPAA. You're going to hear about HIPAA, and I'm not going to go into HIPAA in this training, but I'm just going to give you an idea of what HIPAA is. It's HIPAA, just so you know. It's not HIPPA like HIPAA. It's misspelled a lot of times. But HIPAA is basically the patient, keeping the patient data safe. It's about patient privacy. And as a healthcare organization, we need to practice keeping our patients' privacy, keeping their protected health information, PHI, safe. There's three areas. There's the actual administrative area, the team, the physical security, and the technical security. So what that means is, for you, you need to realize that you can't talk about patient information in front of other people, private information. So I'm not going to greet a patient in the reception area and say, "Oh, great, Mary, you're here for your crown. We're so excited. You owe $27 on your balance, and we're glad that your son has a cleaning next week." Like, you can't do that when other people are around. You have to be careful of what you say about patients' privacy in front of other patients. You have to be careful of your emails, what you send about patient privacy, that you use an encrypted email. You have to be careful about access to your computers and where you're going on your computers. We have to be careful of our server. The server is the computer that runs the whole network. We have to be careful of that. So HIPAA is something that you need to get trained in. You will get trained in. And then you need to make sure that basically the gist of it is privacy for the patient, privacy for their protected information, their health information. What I try to teach my team members is never give two pieces of data away about a person in front of somebody else at the same time. So don't say, "Mary, you're coming in for your crown," or "Mary's tooth hurts on number 27 and she just had a root canal on it." That's private information, and we don't want to say that in front of other people. So basically, HIPAA is privacy for patients. The next thing is OSHA, and OSHA is Occupation Safety and Health Administration. And this is not just to dental. This is, you see OSHA in all different types of industries. But so basically for us, what OSHA means is how we the processes and procedures we need to do to make sure that our employees are safe, remain safe, and that our patients remain safe. So OSHA doesn't just mean in the back office. We have OSHA in the front also, but it's a lot more in the back office area. So things like you need to have an eye wash station. We need to make sure that we're keeping the material safety data sheets. We have to wear gloves. We have to wear masks. Like that's all determined by OSHA. So when you talk about OSHA and you hear about OSHA, this is what OSHA is. And you should get training in OSHA. And then if you do go into the clinical space, you should know all of the rules about OSHA and what we need to do to be compliant in the back.